Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss few more topics about anatomy, the anatomical part 2. So let's learn today about otomy, the anatomical term otomy, which means cutting or making an incision into a body part. Okay, so in this episode, let's discuss about all otomies. First one is amniotomy. Amniotomy means an incision created to accelerate labor. Amniotomy involves rupturing of the amniotic sac to induce contractions for the delivery of a baby. It's as shown in the picture. That is amniotomy. Next one, bronchotomy. A procedure that ensures there is an open airway between a patient's lungs and the outside world. An opening will be created. A procedure that ensures that there is an open airway between the lungs and the outside world. Okay. See, there is an opening which is mentioned in that in the picture, stoma. An opening is created, and this will be done using bronchoscope. Next, coelotomy. Coelotomy, another name for coelotomy is laparotomy. Coelotomy or laparotomy. A large incision through the abdominal wall to gain access into the abdominal cavity. For any surgical procedure, if the doctor wants to enter into the abdominal cavity, he'll create an incision in the abdominal wall, and that procedure is called as coelotomy or laparotomy. Now, colpotomy. Colpotomy means extraction of fluid from the pouch of ductless. Ductless represents the posterior side through a needle. You can see it in the picture in male patient as well as in the female patient. Where is colpotomy? The extraction of fluid from the posterior side. From the posterior side, see, drainage through anterior wall of the rectum. In female, posterior colpotomy to drain pelvic abscess on the posterior side. It's through the pelvic side. Craniotomy. Craniotomy means a bone flap is temporarily removed from the skull to access the brain. In order to access the brain, a part of, like a portion of the bone flap will be removed to do the procedure. Okay, and it is removed temporarily. So after the surgical procedure, it will be inserted back. So that procedure is called as craniotomy. Escarotomy. A procedure used to treat third-degree burns. See the burnt area and see the surgical cut in the picture. It's an emergency surgery performed in individuals with circumferential full thickness burns, means third-degree burns. A surgical cut will be inserted to treat the burnt area. That is called escarotomy. Episiotomy. Episiotomy means a surgical incision of the perineum and the posterior vaginal wall. This usually happens during the delivery time. See, you can see the head of the baby and vagina, and posterior vaginal wall. There will be and a surgical incision will be done to ease the delivery, normal delivery, and that procedure is called as episiotomy. Now, fasciotomy, a surgical procedure where the fascia means area that contains muscles and nerves. That area is called as fascia. is cut to relieve pressure in the muscle compartment. So this is a surgical procedure where the muscles, where the fascia, which means muscles and nerves, it's being cut to relieve pressure in the muscle compartment. And that procedure is called fasciotomy. Next is hysterotomy. Hysterotomy, incision in the uterus, and is performed during a C-section. Incision, for a C-section, an incision is being done in the uterus, and that procedure is called hysterotomy. Now, myotomy, procedure in which muscles are being cut. As illustrated in the picture, before surgery and after surgery. Some muscles are being cut. Mucosa, split muscle. Here in the split muscle, few muscles are being cut, and that procedure is called as myotomy. Now, osteotomy. A bone is cut to shorten or lengthen it or to change its alignment. A portion of the bone is cut. See, on before procedure on the picture, a portion of the bone is being cut and then the alignment is corrected. That procedure is named as osteotomy. Now, phlebotomy, an incision in a vein with a needle. For example, drawing a blood sample. That's an example for phlebotomy. Now, pulpotomy, removal of a portion of the pulp, including the diseased aspect. This is related to the teeth. So, a portion of the pulp is being removed, including the diseased aspect, where there is a infection, and so that procedure is called as pulpotomy. Radial keratotomy, a refractive surgical procedure to correct myopia. This is an eye procedure in order to correct myopia. For that surgical procedure, like incision is being done in the cornea. That procedure is called as radial keratotomy. Sphincterotomy, treating mucosal fissures from the anal canal, which is also called as sphincter muscles. Treating the mucosal fissures from the sphincter muscles. This is a procedure that involves making a cut in the biliary sphincter, the muscle that allows bile to flow into the duodenum. That muscle is called sphincter muscles, the muscle that allows the bile to flow into the duodenum. So that procedure is called as sphincterotomy. Now, thoracotomy, incision into the pleural space of the chest. In this procedure, a cut is made between the rib bones to access the organs inside the chest. In order to access the organs inside the chest, the physician will be will do an incision into the pleural space of the chest, and that procedure is called as thoracotomy. Now, thyrotomy, incision of the larynx through the thyroid cartilage. You can see the midline thyrotomy. There an incision will be made in the thyroid area, thyroid cartilage. Incision of the larynx, and that procedure is called thyrotomy. Tracheotomy, an incision on the anterior aspect of the neck and opening a direct airway through an incision in the trachea. An incision will be made in the trachea on the anterior aspect of the neck to direct the airflow. The procedure is called as tracheotomy. And you can see in the picture tracheostomy tube where the tracheotomy procedure is being done. So friends, that's all for otomy. Next we will be moving on to the ectomy procedures in the next episode. So if you like this video, please like and share, and please subscribe to my channel. Thank you. Bye.